Okay, in this drug video, I'm going to talk about Clomid or clomipafrine. It is a ovulatory stimulant. It helps with mothers who want to get pregnant. There are many guidelines for a doctor to start a patient on Clomid. It's not just, you don't just show up, hey, I can't get pregnant, and get put on Clomid. Um, it is helpful if the reason the patient isn't ovulating is because of PCOS, post-oral contraceptive amenorrhea, which like they've been on birth control for years and years. They're just having a hard time ovulating, hard time, hitting those days getting pregnant. So with administration of Clomid, the patient is going to continue to try and track their ovulation days, whether it be by ovulation testing strips or basal body temperature. And the 5th day into ovulation is when they start the Clomid. Most doctors will let you do this up to 6 cycles. And then there's, like I said, a whole list of considerations. You can't have any cysts. You can't have abnormal vaginal bleeding. Liver function has to be normal. They have to check your estrogen levels. If you have endometriosis or endometrial cancer, you would not be a candidate. And then they kind of make sure that the infertility isn't due to other things like a thyroid disorder, adrenal disorder, or if it's the male who's infertile, then obviously a doctor's not going to start a patient on Clomid. Most of the side effects are very mild and usually go away once you stop, but some of them are like constipation, a rash, depression, dizziness, insomnia, increased urine output, vertigo, and vaginal dryness. And there are some risks, and a lot of what I read about is it's very important that the provider sit and discuss with the patient, because you can have a risk for neonatal abnormalities like club feet, heart defects, deafness, malformation of genitalia. It can also, it's been linked to tubal pregnancies and the possibility of a miscarriage. So like I said, they're very specific on ruling out other reasons for infertility before a doctor's just going to place a patient on Clomid. But I feel like it is pretty frequently used for couples who are trying to conceive, and very important for us to discuss and be able to educate our patients, especially about the ovulation and how you track and know when you need to take your Clomid. The normal dose is 50 milligrams for 5 days. Once you cycle through, if you have not conceived, then they up you to 100 milligrams for 5 days. So we are going to go see our patient who is trying to conceive and give her the first 50 milligram dose of Clomid. So this is our patient Tina. She is in our fertility clinic today. Her and her husband have made the wonderful decision to try and conceive another child.
Hey Linda, this is Tina with Dr. Lee's office over at Ferry Cardiovascular.
Okay, so we have confirmed that Tina is ovulating via her basal body temperature. This is day 5 into her cycle, and she is going to get a 50 milligram tablet of Clomid and continue that for the next 5 days.